Hello students, we will discuss often seen surgical condition that is one of the skin tumors. Just see what this condition is. Look at this in the sole, exophytic, dry, and look at that everted edge. There are everted edge, undermined edge, beaded edge, sloping edge. Sloping edge is healing ulcer, undermined edge is tuberculosis like this, and punched out edge is for the trophic ulcer, and healing ulcer is sloping, and beaded is rodent ulcer or basal cell carcinoma, which is the commonest skin malignant tumor, and squamous cell carcinoma is everted edge like this, raised and everted edge. So typical, you can see there, but dry, it is dry, exophytic, raised and everted edge. So that is the typical look. So what is this? It is the verrucous carcinoma sole, often called as carcinoma cuniculatum. Maybe MCQ, remember this picture, it will give a clear idea. So what are the features? Raised everted edge, dry, exophytic, warty growth. Regional nodes are not involved. Remember, first you have to examine. In this, you have to examine popliteal lymph node because sole drains into that, and especially heel, popliteal node, inguinal nodes, vertical group of lymph nodes, superficial and deep both, and iliac nodes, external iliac nodes, because you step up above this. If it is squamous cell carcinoma, these lymph nodes are involved. In verrucous carcinoma, because basement membrane often is intact and it is not involved, so this will differentiate. It's got a very good prognosis. So wedge biopsy you take, do MRI and wide local excision with the proper reconstruction, maybe flap, you can call reconstructive surgeon and do a proper job, will be able to save the limb and cure the disease. One of the curable malignancies, verrucous carcinoma, marginal ulcer, papillary carcinoma of thyroid, and often early stages carcinoma colon. We've got a very good prognosis as far as malignancy is concerned. So that is about verrucous carcinoma. It is squamous cell carcinoma type. I said all these things, whatever required thing already. So these points are important. Maybe short note, oxy they will ask, and maybe kept as a short answer question in the exam theory paper. So you have to know what is the carcinoma cuniculatum. So answer the MCQ. Characteristic feature of basal cell carcinoma is keratin pulse, nuclear palisading, foam cells, pigment cells, histological features. So answer this one in your comment box, and tomorrow you will get the answer. So don't forget you the answer, all students please, and go through my clinical methods in surgery, manual of surgery, operative surgery, and my DigiNow lectures through JP Publishers. We'll give everything about whatever your syllabus, CBME, all topics, specialties, operative surgery, instrument, specimen, and images. So students, I hope you understood this small but important topic very well. Thank you very much.